Good evening, everyone. My name is Agnes Njue, Health System Strengthening Specialist. I work as a capacity building manager at MESDS. Welcome to this presentation. I'll be talking to you briefly about building resilient health supply chain systems and the role of capacity building, and briefly sharing on our experiences here at MESDS, more so in relation to the COVID pandemic. So the outline of my presentation is I'll briefly talk about my organization, MESDS, capacity building for health system strengthening, impact of COVID-19 to health systems, the impact of COVID-19 to supply chain systems, and how we have built resilient supply systems as MESDS. So briefly about MESDS, MESDS is a corporate entity. It's a faith-based not-for-profit organization. We are registered as a trust, a ecumenical partnership for the Kenya Catholic Conference of Catholic Bishops and Christian Health Association of Kenya, CHAC. Established in 1996 with 3 core mandates: supply chain and distribution for essential medicines and medical supplies, as well as medical equipment. We also have a quality assurance function that deals with pharmaceutical analysis and capacity building. And the 3rd mandate is health advisory services, which mainly deals with training, technical assistance, policy formulations, and the function to which we are interacting with today. So briefly about supply chain and distribution function, we have a quality management system that helps us in identifying and the standards and model quality assurance systems for procurement agencies. We also have a product selection mechanisms, pre-qualifications of suppliers and products, products inspection and release. We also have a WHO pre-qualified quality control lab that essentially helps MESDS as an institution to ensure the integrity of the supply chain and distribution function. The other function is quality assurance services. As mentioned, we have a WHO pre-qualified lab where we do analysis for samples for procurement decisions. We also use that for continuous monitoring of the quality supplies that are delivered to MESDS. And we also do an analysis for samples for external clients across around 18 countries in Africa, as shown in this map here. So we do control analysis for countries in Sudan, Ethiopia, all the way to Madagascar, Chad, Congo, Rwanda, and all the countries mentioned on this graph. Most importantly, through this analysis, we are able to do pharmacovigilance through EPN and also for WHO. What that means is that any sample that fails tests, a recall can be called for that particular commodity. That's through our lab. For the health advisory services, we have, these are our approaches. This was pre-COVID. As you are aware that this has greatly been disrupted, but before then we had an annual training program where we scheduled trainings throughout the year, and participants were invited, and this we used to do face-to-face. We also have facility-based training where we normally go to a particular facility with identified training gaps and be able to build their capabilities. We also have regional training forums where we normally call participants from one region and we talk to them about any particular training needs they may have. And we also do consultancies. This will be around policy development, strategic plans, development of quality management policies, just with the aim of strengthening the capacities for health facilities for health system strengthening. Now, allow me to briefly now talk to you about our approach in training. As mentioned, our training is a holistic approach in that we build capacities for health workers around the 6 pillars of health, which will include leadership and governance of their competencies, setting up of quality care models and systems. We also build human resource management competencies, clinical management, just to ensure the clinical quality quality of services, as well as health supply chain management systems. Over the years, since 1987, when this function was set up, we've trained about 2,000 health workers that have undergone through the annual training program. This is minus the trainings that you normally do as at facility level and through the regional forums. So as you can see, we have participants here conducting a training. This was an IPC training for healthcare workers, and this was a leadership and management training for health managers in one of the facilities here in Nairobi. Let me talk briefly now about the role of capacity building in health system strengthening, after which I'll talk to you about what we have done as MESDS to be resilient for our health systems, supply chain systems over this COVID season. As you are aware is that capacity building is an important session in achieving and creating sustainable health services and efficiencies within the healthcare system. And the functional responsive health system are important ingredients into achieving healthcare goals in any population. So capacity building therefore becomes a very, very key to help build sustainable health systems that are resilient even amidst pandemics like that which we have now with COVID. So how do we do this? It involves three important facets. This probably would be the institutional capacities, where we normally build the SOPs, the QMS systems, policies, or strategic plans. We also have where we improve the infrastructural capabilities, where you procure new machines, new equipment, or set up a new building while you're expanding your services. Then the third facet will include where you build the capabilities of healthcare workers or workers within a health institution, which will include non-clinical staff, which includes essentially even the support staff. So through this approach, individuals and organizations obtain and improve and as well as retain skills and knowledge that are needed for the desired health outcomes in any population. So what have we seen as MESDS as an impact of COVID on health systems? What we saw is that when the pandemic set, we had disruption of health systems. We had increased demand for infrastructure, equipment such as ventilators, the ICU bed capacities. We also had constraint in the human resource resulting from overwhelming patient flows, or where health care workers were isolated or quarantined when they became unwell. Well, also on healthcare financing, we had cases where patients were afraid and a phobia for health facilities, as they thought this is where the virus was being spread. So we then had declined revenues and low patient volumes, so hence declining revenues for the institutions. For health supply systems, as you are well aware, we had disruptions here, resulting either due to increased demand for PPEs and health commodities that were required to combat the pandemic. We also had disruption of strategic plans, the annual work plans, and so forth and so on. All this impacting on the service delivery, where COVID became more pronounced as opposed to other services delivery. So this disrupted the health systems altogether within the season of COVID. So how about the supply chain systems? As you are well aware, this was impactly affected by the pandemic. We had manufacturing closing their factories. So we never had commodities, the supply and demand dynamics. So we had sky prices increase for the essential commodities. Disruption and logistics were halted, resulting from decreased movements, essentially leading to quality of care declining to patients who depended on a particular commodity that they couldn't that wasn't available. We also had overstocking and understocking for selected commodities because there was disruption in terms of forecasting and quantification for the commodities that are stocked either within facilities or even at our level as MESDS. So what did we do, or what have you been doing over this season just to ensure that we have resilience? We have been working with facilities just around this chain to ensure that we build capabilities and strengthen the supply chain systems at our level and also at the facility level, just to ensure that they are able to withstand the disruptions within this pandemic brings. So we've been building capacities around product selection and procurement. We are also building capacities around helping facilities to gain confidence and new information on quantification and forecasting, resulting from the new normal that they are learning from COVID in terms of quantities for commodities that they procure. We are also working with them and teaching them about warehousing and storage. How do you maximize on your warehousing and storage spaces? What is this logistic and distribution that you need to be aware about? How do you plan amid this pandemic where you have movements curtailed for commodities that you probably seek for? We also talk to them about rational drug use, just to ensure that, like the PPEs that you're using, that you're able to use drugs rationally, so that just you can be able to have enough for all the patients under your care. The other element important for us is pharmacovigilance. So what are the qualities of the products you have? What are the side effects or the adverse effects that are coming from the PPEs, from the other drugs that you're using? So this is also key and important for us. And most importantly, quality assurance for the products that you are using, even at that level. So what we have done, we have a health commodity management course where all these modules are taught. And we have converted this to an e-learning module, and that this can be accessed on this portal down here. And all this basically to ensure that we have access to the commodities that are required at the right time, at the right quantities, and at the right for the right patients. So as I conclude, I just want to show you some of the other things that we do at MESDS. We have a medical equipment section where we are able to supply medical equipment to facilities that are our clients. We also have a modern warehouse where we are able to store commodities enough to meet the needs for our customers and the clients that procure from us. And here below are the contacts through which you can contact us with for the marketing and field support, trainings and partnership. We have a website, and as I mentioned, we also have that portal. So with that, I want to conclude there and wish you the very best as you participate in this workshop. Thank you very much.